Dr. Johann, cardiologist at Care Hospital, Hyderabad, and today I will be talking about two issues. One is the role of cardiac CT in the evaluation of patients who are undergoing left atrial appendage occluder devices. As you note that atrial fibrillation is a major health concern as we grow older, and one of the biggest problems with atrial fibrillation is the risk of early stroke or premature stroke, because 80% of patients with atrial fibrillation seem to get stroke because of thrombi in the left atrial appendage. Hence, with the data that is available to us, left atrial appendage closure is almost equal to the traditional warfarin and coumadins that are available in the market, especially in those patients who have a major risk or at high risk for bleeding. The technology has now become mature, and we have 2 or 3 players, but I'm going to be especially talking to you about the Watchman device, wherein the role of CTA is very, very important. We know cardiac CT has been a major disruptive force, I would believe, in cardiology, starting with just calcium scoring to basic coronary anatomy, and with the TAVR development, a cardiac CT is now center stage as far as structural heart disease goes, and this has now become the norm in left atrial occlusion as well. Cardiac CT has 2 purposes. One is to evaluate patients who are good candidates for the left atrial appendage occluder, and post procedure it helps in identifying thrombi, complications, paravalvular leaks in those patients who have undergone the device. The good news is that cardiac CT can be performed almost like a normal cardiac CT, with just a few exceptions, in that we take the ROI at the left atrium and then we proceed to do a retrospective scan. Once that is done, the post processing includes evaluation, number 1, of the left atrial appendage, the shape, the morphology, and also those patients who actually cannot get a left atrial appendage occlusion. For example, patients with left atrium or left atrial appendage thrombi, very well detected on CT. Some patients have already been surgically closed because of a prior mitral valve repair or replacement, and there is no left atrial appendage to speak of. And because of its excellent spatial resolution and excellent 3-dimensional views, it is very good to assess the shape and the size of the landing zone and the ostium. Therefore, because of the device limitation, we have devices only from 22 to 33 sizes. So therefore, any size of less than 18 mm, we cannot put a device, and any size which is greater than 35 millimeter, we cannot use a Watchman device. So immediately the occlusion devices are excluded, and patient has to be on other traditional forms of therapy. The other thing that we look at is the length of the lobe, and again here, unless you have a length of at least 17 mm, it's going to be very difficult to fit in the Watchman device. So with these initial thoughts, patients can actually be enrolled into a Watchman program, or they can be completely excluded. Once that is done and we find that the patient is a good candidate, then we look at things like the angle of the left atrial appendage, anterior or posterior, because that will help us use the right catheters to take the Watchman device across. We are very specific about assessing the landing zone, and also the lobes have to be assessed in terms of length. Once that is done, these are good patients to undergo the procedure, because we have the right catheters we can use, we have the right size of the device we can use, and any other interatrial abnormality can be assessed almost immediately. After the device, the CT is again done, and here it helps us form a very good image of the device in situ, completely well fitting and const, and also thrombus which is formed on the abluminal aspect of the device, showing that the device is well seated and a thrombus is already forming. It also gives us an idea about the fitting of the device, and if there is any paravalvular leak more than 5 mm, then that is a cause of concern for us, and also the orientation of the device. So with these, CT becomes a very, very robust tool in order to image patients in terms of inclusion or exclusion into Watchman program, and post device to look at complications. So this is my take on the CT evaluation of left atrial appendage occlusion devices. Thank you.